Good evening, Dr. Bore and class. My name is Sauda Carrasquero. I am presenting on opioid drug overdose. Today is Tuesday, the 16th of April, class NR 582, week 6, health policy analysis. Introduction. What is opioid overdose? Opioid deaths refer to a fatality as a result of taking too much or a misuse of prescription pain relievers like oxycodone and illegal drugs like heroin or fentanyl. Who does it affect? The opioid epidemic affects most racial and ethnic groups. It affects mostly adults aged 35 to 44 years of age. Background. What are the current rate of opioid overdoses in New York City and the impact of opioid overdoses on nursing practice? The current rate of opioid overdose in New York City, the deaths are averaging 56 persons per week and 3,000 deaths annually. Every 3 hours, someone dies in New York City from a drug overdose. And the impact on nursing is very heavy when having to deal with the nursing shortages and staffing issues and the time it takes for one to spend caring for a drug overdose patient who is near fatality or has succumbed to the drugs. Why is the rates of opioid overdose concerning? It is concerning because of the harmful consequences among people who may or may not know that the drug may include deadly additives. It's also harmful because of the cost on society as a whole, the financial cost. The opioid rates needs to be addressed as to decrease the number of fatalities, the toll it has taken on families, the workforce, and society at large. Who are the relevant stakeholders? The relevant stakeholders are patients, people who are abusing substances, families, religious bodies, employers, nurses, and counselors. Key factors that are relevant with opioid overdoses to consider when analyzing opioid overdose are: it can cause respiratory problems and lead to death. There are effective treatment to address opioid dependence. Associating factors to consider when dealing with opioid overdose. An opioid overdose can be identified by a combination of 3 signs and symptoms: pinpoint pupils, unconsciousness, difficulties with breathing. Options, evidence-based to address opioid overdoses. Options can be effective in Narcan can be effective in treating drug overdose by preventing death if administered in time. Access to free and or inexpensive medications and treatment, and help to break down the biases and stigmas associated with drug use and drug overdoses. Improve the organizational support in nursing leadership by bringing increased awareness of opioid overdose, implement more treatment programs, and continuing education for healthcare workers. Recommendations: a strategy that can be used to address the stigma of drug use is by avoiding negative terms like addict, junkie, user. The history of such negative stigmatizing terms does nothing to help the patient who is struggling with drug addiction or substance abuse. In conclusion, opioid overdose has always existed. However, since the COVID-19 pandemic, there has been a significant increase in New York City. This may have been attributed to social isolation, job loss, health and financial concerns. We all can play a role, especially as healthcare providers, by empowering ourselves with knowledge, continuing education, and lending a sympathetic ear to help cope with this epidemic. Thank you.